Today on the Mishmash podcast, my guest is Christine Manley, physical therapist for ProCare Rehabilitation in Hazlet, New Jersey. Christine, thanks so much for taking the time to come and chat with me today.
Yeah, thank you for having me. I'm honored.
So we were talking off the air a little bit about what I'm trying to do with some of these episodes and stuff. And so the focus for this run of episodes is featuring women in the sciences. So I wanted to get a couple of different viewpoints and a couple of different professions within that umbrella, just to kind of give some representation and just see what your experience is like as a woman in this particular field. Mm-hmm. So if you wouldn't mind, maybe we could start off just with your background and maybe how you got to this point in your career.
Yes. So I became interested in physical therapy, not the same way like a lot of people did. Like I actually was not a patient initially. That's how a lot of people get into it. I just knew I liked to work with people. I played sports growing up. I was a dancer. Like I did ballet, jazz, point, and I liked to be active. So I knew I wanted to do something with like anatomy, physiology, and I was good at science. So I started to volunteer in high school at outpatient clinics, and I knew I liked it. And I was into strength and conditioning as well. So that was like a big part of how I got into it. Strength and conditioning and physical therapy, they're very different as far as kind of like what the end goal is. But at least that was my way in. So I went to the University of Delaware for undergrad. It was exercise physiology was the major. So I was there for 4 years. And then I went to Drexel for grad school to get my doctorate of physical therapy. And it's like basically 2 to 3 years, like by the time you take your exam and become a PT.
So did you jump right into grad school right after undergrad, or was it?
I did, yeah. So like during that process, I did like volunteer at places. And then you have to volunteer actually in order to get into all these schools and in different settings. So like outpatient, acute care, you can do pediatrics, neuro. That's what I found so nice about getting into physical therapy is that I didn't need to know exactly what I wanted to do. Like I knew I wanted to work with people and I wanted to help people feel better. And then while I was in school, I could kind of find my niche. But I was always leaning towards outpatient because I was an athlete and that was like my original passion.
That's so great. And you literally touched on like my whole list of bullet points here. So this is perfect. So we can kind of jump around from there. And then you went to Homedale High School, right?
I did.
And so do you think that, were there any special programs that gave you a jump start on that path? Because I know that high school in particular does a lot with like the professional development side.
At the time when I went to high school, they didn't really.
Oh, wow.
They were just starting to get into some of these like specialized electives. But no, they didn't. Now I know they have a lot, which would have been helpful.
Yeah, absolutely. Well, and it's funny that you said that because I guess this would be a good point to give some background. So Christine and I met when I came in as a patient for the first time. And I say for the first time because it's become almost like a regular thing. It's funny. Actually, when I walked in a couple of weeks ago to ask you if you wanted to come onto the podcast and everybody was saying hello to me on the way in, I kind of felt like Norm from Cheers. Which is maybe too much of a level of comfort. But like Pete says, I usually just come in every couple of months for a tune-up, is how it is.
Yeah, and we want the environment to feel like a home. Like I remember Pete saying that a long time ago. And I think that's important that you feel comfortable where you're going. It helps with your recovery too, like that mental aspect.
Oh, 100%.
So, yeah.
And so my physical therapy journey began with a different practice in Hazlet. And that was the same sort of environment early on where it just felt like a little community unto itself. And I think that definitely expedited the healing process and stuff. But the way Pete and everybody there runs the program at ProCare, it really is like, it's the best way I can describe it is it's professional, but fun. Like it's always kept light for the patients, but you guys know your stuff, and you're clearly in charge doing what you do. And I think that helps in the long run.
Good. I'm glad it comes across that way. Cause I think that trust between a PT and a patient is extremely important, that I'm not going to let you down. I'm going to be honest with you, but then it shouldn't be like you're dreading to come.
That's the next question I want to get into. And it's funny because that atmosphere is important. And I've probably said this on like 3 or 4 consecutive episodes here now, but I tend to be, my wife calls me the mayor. So when I'm around, I'm always talking to people and chatting and stuff. And when I came in that day, I held the door for a guy who clearly looked like, I whizzed past him walking through the parking lot, which usually doesn't happen when I'm heading to ProCare. So I waited and held the door for him. Right. And within the next 3 minutes, he's telling me all about all the stuff that him and Pete have been doing and this other thing. But I think that he was enthusiastic about being there, and he trusted that, you guys were going to get him right. And that's how it's been for me. So
that's great.
I've got no complaints. I'm curious though, there must be some challenges with being a physical therapist, but also just the program to get there. I know for my wife and I were just talking about this when I was prepping for the episode. It seems like such a daunting thing because, like you mentioned before, you didn't have to specialize. I think that in a way is sort of scary because there's so many situations you can encounter. So through your schooling, if you remember that experience, was that something that ever daunted you? Were you ever concerned about like just the sheer amount of stuff you need to know to be successful? Or
so I think when you're going through the process of schooling, you are just kind of taking it like one class at a time, one step at a time. At least for me, that's how it was. Like, I think if you do think of like the whole thing, it is kind of intimidating, right? And there's a lot of like difficult classes. Like neuro for me, it was one of the most challenging. But I think having a good support group, like I had like friends that were in the program with me. I lived with, when I was in Philly at Drexel, I lived with 4 girls, or I lived with 3 girls. There was 4 of us, and we were all PT majors. And so having that support, you can ask questions, you're not going to like forget there's a test coming up. That was always very helpful. Like even in high school, I always asked for help. I always went to the after school help. And so like, I think because of that, like it was never quite daunting to me because I just took it a step at a time. I utilized the help that was around. And not to say, I mean, I got extremely nervous for every single test. Even now for continuing education, like there's a quiz, doesn't really matter what your grade is, I get nervous, right? So like, it's normal, I think, to be nervous, but like making sure you're just taking it one step at a time, those like short-term goals. And then it's not that daunting. Yeah.
Right. And I've noticed too, in terms of not even just the physical therapists specifically that I've encountered, but more the students, because you guys do a lot of student hosting at ProCare, yes, which I think is phenomenal. It's a great, what better place to start as a student than there, where the knowledge is there, the support is there, but I don't want to say that you can tell who's going to succeed and who's not. That's way too broad of a stroke. But I have more of an inkling for which ones are more likely to succeed. And I think a lot of that is something that you embody, right? So in the sense of being really self-motivated, self-driven, hardworking, because you need to be able to handle a lot of the pressure, but also keep yourself rolling. Like it doesn't seem like a field that you can just kind of coast and, make it through. So
yes. And a big thing is like the social aspect of being a physical therapist. And it doesn't matter what setting you're in. It could be home care, pediatrics, neuro, outpatient. You need to know how to talk to people and also read people, right? So that does take kind of experience to learn well, but I think being around people, like having a job when you're younger, like it doesn't even have to be specific to physical therapy, but a job where you have to interact with people is wonderful. Because like you can always teach someone, I don't know, math, let's say, right? Like you can't, it's more difficult to teach someone how to socialize with another person.
Well, I don't know if you would consider that bedside manner specifically, but as you said before, you are a doctor of physical therapy, right?
So, yes, yeah.
But I noticed that was one of the key things in terms of which ones I thought would be successful versus which ones weren't, was some of the students that I worked with, or that worked on me rather, the ones that were more personable seemed more at ease and more confident. And I don't know how much that comes into play, but the maybe 2 or 3 that I remember that were definitely either introverted or even antisocial in some extent. I did wonder, I hope that they were on the right path for them, because that's got to be a difficult transition to make if you're not used to socializing. It's not one of those jobs where you want to just stand there quietly.
Yes, exactly. And so like that's a big thing we try to tell our students when they come in is like, don't even worry about the PT part of it. Just get to know the patients, because if the patient is comfortable, like just with you socially, then the rest will come. So that's a huge, especially now with like everyone being on their computers or the phone, you need to be able to talk to people.
Absolutely. And 2 of my recent episodes featured a nutrition coach who I actually just hired because of one of those episodes on a whole
awesome.
A whole new journey, a whole separate thing. But one of the things that we were talking about was basically what would make for an ideal client, right? And not so much an ideal client in terms of the success, but more, I guess I started to think about it more in terms of like your patients and what makes for a challenging patient versus an ideal one. And I know for me, not that I would consider myself ideal in any sense, right? But whenever I'm there to work.
Yes.
And I get the sense that not everybody comes in as willingly, looking at it that way. I think a lot of times they want you to do the work for them, if they even want to be there at all, because that's a big challenge. I'm assuming you've had some of those negative encounters. How have you weathered that and maintained your professionalism, which I can't imagine you ever not doing? So.
Thank you. And first of all, you are an amazing patient. And a big part of that is because you are willing to put the work in. I know you're going to do the homework exactly as I tell you to do it. When you're in the clinic, you do exactly what I say. And also, like, you communicate back to me with how you're feeling. But you're right, not every person is the same way. But it's my job as a physical therapist to tailor to the patient and their personality and still get my job done. So that's where like you have to be able to read people and kind of figure out what is going to work best for this patient and what are their goals. Everyone's goals are different. Some people come in and, they want to get back to CrossFit or like pickleball and other people just want to be able to walk, So I think as long as you have the other patient's interests in mind and you don't like try to fight them on things, you work with them through things, then like I would tell you, I need you to do this 3 times a day, every day, and you would do it. I might have to start slower with somebody else just to get them to do something.
Right.
Because if I give them too much, they're gonna hate me and not want to do anything.
Right. And for what it's worth, just in terms of, I respect you immensely, but part of why I respect you so much too is the fact that when I've seen you interact with other patients who just overheard conversations, in the office, you never treat anybody differently. So if someone's goal is to get back to CrossFit or running marathons, you approach them the same exact way as someone else who just happened to have a slip and fall and wants to get back to, a comfortable, sedentary lifestyle, right? And
thank you.
And I think that's great because again, so many people that I know that have come into physical therapy have athletic backgrounds. They have a foundational fitness or fitness foundation rather. And I think it's important to be able to handle people who may not come from that background. Because I know for me, it's difficult to understand folks who just don't do anything,
Right.
And not be judgy. So
right, exactly. And that's where like the mind frame is different than like a strength and conditioning kind of mind frame. It's more of like, I want to get this person healthy and happy. So like that's the biggest thing. Like if my patient's not happy, they're not going to do well. So that's why like I might do something for them like that I just know is going to make them happy. But then at the same time, we're also doing things that I know are like physically necessary that are also going to get them better.
Right. And I never really associated the two, but now that I'm thinking about it, there's clearly crossover points between strength and conditioning and physical therapy. So I don't know if you've heard of RIPT, RYPT, down in Tinton Falls.
Yes.
But my daughter actually just completed their program. I mean, they do it seasonally. So she completed the spring program. Unfortunately, she's in great shape, good conditioning, but she was like the third to last kid or the last kid down the court every time. And it was like she ran with these, big wooden shoes on or something. So I realized, I said, I don't think she knows how to run properly. And I just wanted her to get more, I knew if she got into a program like that she would gain more confidence, get into better shape. And long story short, she finished it. She was doing some kind of squats with like a 50-pound dumbbell. And she was so proud of herself for doing it. And that's kind of one of the things that I like about you guys and on the physical therapy side and then RIPT over there is it's about building a healthier lifestyle. It's about more than just, hey, do these exercises and then you're done. And you guys try to do the same thing too, where it's about living the best life that you can within whatever confines you've got, which I think is cool.
Yes, I do think it's important for young kids to get into strength conditioning, like, starting with just like body weight types of exercises to start that healthy routine early. Because I exercise, like obviously I played sports when I was younger, but like my dad got me into jogging. So I was just in this routine already, and I kept that up as I like became an adult. The children mess it all up, but...
So speaking of then, you're a mom to two awesome young ladies, right?
Yes.
And how did that affect your, if you're willing to discuss it, how did that affect your role as a physical therapist? Because that's, the job itself is pretty demanding, not just physically, but emotionally, psychologically. It's a long day. And so I know for me, the biggest shift once we had kids was just, again, that strain, the emotions, the ups, the downs, and everything. So how did you navigate that process of shifting gears or even now shifting gears?
It honestly wasn't that bad, I think, because, I mean, it's a completely different setting, right? So, like, when I'm at home, I'm at home. And when I'm at work, I am at work. And so, like, you walk into that new environment, and it's almost like this, like, a whole new day, almost a whole new person, right? There's like mom Christine at home, and then there's PT Christine when I walk through the doors of ProCare. So that's why I love going into ProCare, and I love like going into another setting and not working from home. Because like if something is stressful for me, like by the time I talk to my first patient and I'm focusing on them, like I forget about all of it. And then once I leave, like I can like get back to what I need to for home. But that's what kind of makes it so nice.
Yeah, and I think that separation is important in the sense that not enough people do it nowadays. And this is even before COVID, when working from home really, ratcheted up. I think just in general, too many people had it bleed over from one to the other, and it's a difficult thing to achieve, but I think it affects you when you don't do that. And I know as a teacher, that was one of the first things my cooperating teacher told me was, like when you walk into the classroom, whatever happens in the classroom stays there. Whatever you walked in with, leave it at the door. And it was such a necessary thing.
Yes.
But so in terms of walking in the door, I was curious if there's such a thing as like the most common situation you've faced as a physical therapist. Is it slips and falls? Is it, just sort of a range of things?
So, I mean, we do see so many types of patients that there's not one that like fully dominates, but I would say like we do see mostly spine patients.
Oh, right. So, you guys have a focus on spine and back stuff, right? Specifically?
Yeah.
Or, okay.
Well, I'm McKenzie certified. So it's like 4 long weekends of doing a course, and then you have to take an exam and do like a practical component.
And so is that the McKenzie method, just in case people don't know? So do you want to just run into like a quick synopsis of that for people?
Yeah, so the McKenzie method, it's primarily known like with the spine, so cervical, thoracic, lumbar, and it helps with like the evaluation process, and it kind of helps to categorize it. But the typical McKenzie that a lot of people know, we do repeated movements depending on whatever the diagnosis is to help with the pain. But it also is used on extremities, and I've had a lot of success using it on extremities as well. So what's nice about it is if the typical McKenzie that you think of works for the patient, you see improvements immediately. So not 100%, but you see a positive change. But if it doesn't fit that category specifically, it helps you to find the appropriate category and then the best way to treat that patient.
Oh, okay. That's cool.
Yeah.
You mentioned before there's an array of situations or conditions. I think I saw someone there once they had like vestibular difficulties. What are some of the more obscure situations that you've faced, if you can discuss them? I know.
Yes, obviously I can't talk about anyone specifically,
right.
But I am vestibular certified, and then Chris that works as well. So it's a specialty that like once you graduate, you have to do like more continuing education credits in order to like properly treat it. That's why just Chris and myself treat patients like that. But it's a very different type of physical therapy compared to treating something more orthopedic. Like it's a little more like neurological.
Right. Okay. That's what I thought.
Yeah. So like you're dealing with the vestibular system, concussion, but there are some that are very severe. Like, like some people are very dizzy, they get sick. And it affects like their daily life, like almost everything that you do when it's a certain type of a vestibular issue. So like sometimes those can be like the most challenging because there's like so many different areas that you can be working on because not one vestibular patient is really the same as another. But that's what keeps it interesting.
And that's really, if I had to describe what it is, because I don't know what the average person thinks of in terms of physical therapy. I don't know
Right.
how many people have encountered it, how many people haven't. But for me, again, it harkens back to what we said earlier about restoring a lifestyle, which to me, it's funny. We were just, again, talking off the air that we just picked up the puppy today. So
So cute.
big changes here. But I was speaking to the breeder, and he's in one of those rare situations where essentially what he does, his job is just to bring people joy, right? And and in a way, physical therapy, even though the patients may not feel that way at the time, right?
Right.
That really is what you're offering them. You're giving people their lives back, which I mean, that's got to feel good if just from the altruism standpoint to begin with.
Yeah, I think that's what I like about outpatient is with most people, you see a huge change from the first day you meet them to their last visit. So like it's very like gratifying to like see someone like go from not being able to do the things they really want to do, and then now they're back to their prior level of function or like even better. So yeah, that's one of the reasons why I like outpatient.
Right, which I'm a testament to as well. It's funny how the timing and everything works. So the last time we worked for my knee actually was a running issue. And so you had said that I could get back to it. I just needed to take it slow. And I knew innately, like I wasn't ready for slow. Unfortunately, it was an on-off switch, not a dimmer. I finally got the dimmer switch installed. So we'll see how that goes. But it's great to be able, like, I feel confident knowing that if I want to take those steps that I can, and if there's a problem, I know that if I come to you guys again, it'll help. So that's a big relief for me just in terms of living an active lifestyle. And to be fair, I would say in 90% of the cases, what brought me in was something stupid that I did to myself, right? Like the last time, spending way too much time sitting on the floor, wrapping presents and playing with the kids and stuff. So again, it's a learning process. And, my background was more on the fitness side. So I did like, impersonal personal training stuff like back in high school and early college. Cool. And when I went to talk to Pete recently about something fitness related, I learned like I used to be a big stretcher. And when I spoke to him, he was talking more about dynamic stretching. And so we had a discussion that led me into this whole new research path. And I had no idea. Like, so it's cool too, like to always be able to learn something new and, adapt and adjust, I guess.
Yeah. A big part of actually what we do is patient education, because I could just have you come in, I could work on you, I could give you this exercise and that exercise and send you home. But in order for like that long-term recovery, it's so important for someone to understand like why they're in the predicament they're in to begin with, and then some type of lifestyle change that's going to help keep the pain away. So it is too. It's almost like you were talking about the nutritionist, and it's probably like a lifestyle change, right? It's the same thing for people that come to see us. Otherwise, it could just happen again.
Right. Absolutely. And that's from the nutrition side too. There's a need for a willingness or an openness to do it. And I mean, I think that this level of success is completely predicated upon that, because if you're not willing to accept ownership, like again, I knew I did it to myself every time. One time, I think in 2018, it was because we did the cross country road trip. I figured it out after the fact. It was 11 hours of driving a day for 8 straight days.
Wow.
We covered a lot of ground, but I paid for it, over the next couple of months. I feel like we mentioned communication too. I think just in terms of like the evaluation process, that's got to be really important. How do you handle a patient who cannot accurately describe what's going on, and how much do you have to rely on your, education, your experience to solve the mystery, as it were?
Yeah. So sometimes the history taking part of it, patients don't always know how to describe things, especially with vestibular type of dizziness. So I don't want anyone to feel uncomfortable. So like, I don't like try to like dig in and get them to say the right word to me. I can usually figure it out like when I take a look at them too, through just my evaluation. But even like sometimes just like then getting into normal conversation, that's what it is. Like when I do my history taking, it's really just a conversation with the patient. And then like as that hour goes on, like I continue this conversation throughout the treatment, and then I can figure it out. You don't have to describe it to me like one certain way. I don't try to lead someone in one direction, to lead it towards like something I want it to be as opposed to like what it really is. But I know generally, like, with this diagnosis, these are the symptoms. With this diagnosis, these are the symptoms. So I have to also be able to make sure I'm asking the appropriate questions or ask a question differently in order to get what I need.
Not to put you on the spot, but have you ever had a situation where you were stumped and you had to maybe confer with someone else? Like, what would be the process there if you were just like, you know what, it could be these 5 things, but I really don't know which it is?
Yes. And that's why I like working with like a family where I'm in a clinic. There's 5 or 6 of us, but we talk to each other all the time, like bouncing ideas off. Or like, if I was thinking something, but maybe not feeling fully confident, because that's natural depending on what's going on. Like, then I can speak to somebody else, and it's always helpful. So we call that like differential diagnosis, like when someone comes in with like, because usually it's like, back pain. Okay, so like back pain can be treated so many different ways. Like, what is the diagnosis that I'm going to come up with? So we should be asking questions a certain way to narrow it down. And then if it's not whatever I'm doing, if it's not working for that patient, like instead of getting like down on yourself or frustrated about it, it's always good to consult with another PT, or you reevaluate. That's why like really every visit that my patients are coming in, I talk to them, see how they're doing. I ask if they're doing their homework, like, so basically the exercises at home. But then I look at like range of motion, I look at strength, because I want to make sure that I'm seeing improvements. And if I'm not seeing it within a time that they really should be, then I need to change what I'm doing. So that's why, like, as you are more experienced, then like usually things work out. Like, you pick it up a lot quicker. But then like as a new grad coming in, as long as you're not doing a disservice to the patient and like you're not stubborn, you're like, this is what it is, this is what I need to do. Like, it really is just a constant evaluation every time you see them.
And again, to your credit, right? I think it takes a certain amount of self-confidence to be able to ask for help, because you don't want to be viewed, and again, I obviously don't work with you guys, but just watching the rapport that you all have together, it really does seem like, no one's going to be like laughing at you behind your back or,
Right.
saying something like that. And even the support staff, I'm always amazed by how knowledgeable they are in terms of the exercises. And, I've been corrected more than a couple of times, right? Because of form and stuff, which
But
I want.
that's good. Exactly. Yeah.
I want that. I'm there to work. So I don't want to do it wrong and then wasting my time. Although, just from the patient side of it, it is funny to kind of like people watch, because not that there's a lot of waiting around, but sometimes, you're just observing.
Right.
And so I can always tell who's cheating and who's not by the way they're looking around too, which is pretty funny.
Yes, we know the cheaters too.
Right. So in terms of, you mentioned professional development earlier. In terms of the tools of your trade, right, the items that you have at your disposal, how often do you guys have new stuff come in? Because I've seen like the anti-gravity treadmill, which I've been on and is super cool.
Yeah.
The ultrasound machine. There's things that come into play that I never would have really thought of in terms of being tools for physical therapy.
Right. I guess it's just kind of as we notice we need something, like maybe it's like twice a year, like, we got the massage gun as like just another tool to use.
Do you find that to be useful though? Because Heather wants to get me one, and I just feel like it's just going to be a waste for me.
So with a lot of things, it depends, right? Everything is individualized, and because like, you need to make sure you know how to use it right too, right? But for a lot of what we do in physical therapy, you don't need a lot of tools. I mean, like having the anti-gravity treadmill has been like so helpful with transitioning patients to walking, running, but you have a TheraBand, you have some weights, you have some dumbbells, and then like, some of the other tools I guess they can be helpful, but like not always like, necessary in order to get that patient fully recovered. But occasionally we'll get something fun, like just probably to like keep us interested and try something new. Yeah.
I've said this before to you. I'm never nervous when I see you guys loading up weights onto, the pulley system or, if there's like a squat rack or whatever it is. I'm freaked out when there's a rubber band, a little ball, and something else because I know I'm going to be in for it with that, especially like the thumb stuff is always brutal. So one thing that I found interesting was when this physical therapy journey that I started on, it started off in a much more hands-on environment. And for that injury, if I never told you this, I had a grapefruit growing out of my ankle. Like it turned into not even a softball size. It shot right past that. So when it finally healed, never broken, nothing, bad. It was just, I couldn't run. I couldn't get stuff going. So that's how I wound up in physical therapy the first time. That approach was, again, much more hands-on oriented. And when I started at ProCare, it was a surprise because of how exercise centric it was. And looking back, I see benefits to both. But one of the things that's great about ProCare's approach is what you mentioned earlier, that it's enabling people to kind of do more on their own and then sustain things. And that was, unfortunately, I almost like abused the physical therapy situation the first time because my brain was like, well, if I break it, they can fix it. So I would go and push myself to do 9, 10 miles, 11 miles, whatever it was, knowing like, I'll go there. And that's not a healthy mindset to have. And I think if the work was put more on me, I definitely would have reconsidered that approach. So
yeah. And that's where you have to be able to communicate with the patient and understand their personality in order to, at least try to lead them in the right direction. But we're always here for you. Like sometimes people have a hard time being discharged and kind of letting go. And I say, listen, like we can say today you're discharged. And if tomorrow you decide to come back, you give us a call. Our door is always open, like, if you need us for anything.
I like that you guys call it graduation day, right?
Yes.
Because that is it. I've gotten to the point now, I don't know how many degrees I would have earned by this point if they were all graduation days, right? But it's always, at least for me, it's now a good feeling. And there's definitely a part, the thing that I miss the most when I'm finished with a session or when an issue is resolved, rather, is more the camaraderie. Like, it's something I do look forward to. It's the work is whatever it is, but just being in the environment, again, it's fun. The music, the personalities, everybody's really nice and supportive, which is great. So in terms of gender, right, because this has come up for me in different professions that I've discussed on here, do you feel like women are well represented within the field? Would you say it's male dominated? Is it 50-50?
At this point, I believe it is female dominated for whatever reason. And maybe it depends on the setting, but even an outpatient, if I would give a percentage, like I would say at least 60%.
60-40, right? That's what I was thinking. Yeah. Okay.
Yeah. But I mean, it's great. And as far as young girls thinking about coming into physical therapy, I think it's great that you stay active. Like I'm always on my feet. I think the communication aspect, even mentally, I think it's good for me too, to talk to patients. I've become more of a confident person being a physical therapist, and I've only worked at ProCare. I've been there for almost 10 years now. So they've helped me become more confident too. And I think that kind of carries over into your life as well. Like maybe being a little bit more assertive, because I've always been a little bit of like a people pleaser. I don't speak up very much, but this has actually helped me a lot. I think especially when you know that you're good at what you do and you see people succeed, that's really nice. I mean, it's late nights. You have to, for outpatient, you have to be able to work late sometimes. Outpatient, sometimes you work on weekends. We're not open on weekends because Pete, when he first opened up it was Homedale at the time, now it's Hazlitt. He was family time is so important. I want my weekends for family time. I want the same thing for my coworkers. But acute care, you'll have to work holidays and some weekends. But with every type of occupation, you have to think about what that means for your lifestyle. But overall, I think it's a fantastic career.
Yeah, and for what it's worth, you definitely do seem more confident recently, let's say the last few years.
Okay, yeah.
But even when I walked in the door the first time, because you were the first one that I worked with at ProCare.
Okay, yes. Mm-hmm.
And funny enough, your confidence in yourself was what struck me. You carry yourself as a very confident leader. in terms of your knowledge, just all of it. It really reassured me when I came in there because I was freaked out. I didn't know what was going on.
Yeah, that's good. I think that's so important because you need your patient to feel comfortable. Yeah.
Right. And it's funny because, and this is, again, is a testament to ProCare and to Pete and the environment that he's helped foster. Like, I can walk in there and work with anybody that's there and feel confident that I'm going to get, the same level of treatment. It's not like when you're at a barber shop and you're like, oh, all right, I don't want that guy because he butchers
to
people,
cut my
right?
hair, yeah.
But there is a reason why whenever I come, you're the first one that I reach out for because of, again, like the rapport, you understand me. I always feel seen. I know it's like an overused term, right? But I feel seen and I'm not judged for whatever it is that got me there, even though it's going to be something ridiculous, hopefully, right?
Right.
And again, that's a testament to you. And I think it's, like you said, 10 years in the same place. First of all, congratulations.
Thanks.
That's a big milestone in any career. And I think it speaks a lot to, again, the environment and just the way it's structured. It's a special place. And I know a lot of people feel the same way,
Thank you. Yeah, it is true that like we tend to stick with the same patients, right? Like, sometimes depending on people's schedules, things change, and then no one's offended by it either, right? Like all we want is for our patients to feel comfortable to come into ProCare and know that they're going to be treated well. So I think that helps to keep the environment positive as well. Like no one becomes like offended if they don't stick with you or like you come in and you say, oh, yeah, I want Christine. Like no one becomes offended. It just shows that there's a connection and that's what we're all trying to do.
Right. Absolutely. And then just to close out then, in terms of potential, young women that want to enter the field, what sort of course of study? Obviously, you don't have as much control in high school in terms of electives and stuff. I would imagine, did you take AP Bio or any AP Science classes?
So, no AP Science classes. No, just like Chem, Physics, like all like the normal ones. It was like English. It was like an honors English. I'm trying to even remember what I took.
And then for undergrad, so for me, you mentioned before about it being 60-40 in terms of the gender breakdown, right? Mm-hmm. I feel like that, and again, this is just stereotypically, but historically, there are like nurturing professions, right? And I feel like in the same way that women might be underrepresented, say, in high school education or even college education, they're overrepresented in the younger grades as elementary school teachers. And I think because of that nurturing aspect.
Right.
And it's the same thing. I'm excited. I might have a doctor friend come on. She's a medical researcher, the smartest woman I've ever met.
That's awesome.
And again, when I feel like if you were to ask the average kid to draw a doctor and to draw a nurse, I just feel like based on nothing other than just instinct, that they would probably draw a female nurse and a male doctor.
Yeah.
Which I don't like. That bothers me. So that's part of what this is all about.
Yeah.
And so that's why I was just curious for, young women, if they wouldn't do like pre-med as a major. Is it specific to physical therapy?
So for the most part, it's exercise physiology, how like sometimes kinesiology will be the major. It depending on the school, sometimes like they'll, I think, call it like pre-physical therapy because some schools, they do like a 3-in-3 program where instead of doing 4 years and then 3 years, you do 3-in-3.
Right.
So like you go right into the grad program. But yeah, even like in undergrad, really, it was a lot of women that were in my major.
Which is great. And again, the irony is it's also weirdly reassuring in the sense that there's such a drop off for so many girls in sports right around age 12 or 13. And yet so many of the physical therapists that I've met played sports. They played sports in junior high school and high school. They've been athletic and stuff. So at least there are some girls who are sticking with it. And then this is exactly one of the things that I like is it proliferates, that may lead to a career. Obviously not everyone's going to be a professional soccer player, basketball player,
right. Yeah.
Dancer, whatever it happens to be. But this is something that's, if not connected to that athleticism, at least, maybe born of it, which I think is cool.
Absolutely. Yeah. Some way that obviously growing up, you're passionate about a sport or dance or like something. And then we're not going to play it forever, but you can kind of still stay in that same kind of mind frame where you're helping others do these types of activities. And having a knowledge base of it is really helpful with the recovery aspect of it as well. So some kids, like they get injured, let's say, and like can't get back to their sport. That can be mentally extremely difficult. But then they can be an aid for us at ProCare, and like you'll be around like exercise and other people that are playing sports and like talking about it. So like it is good, I think, to have something else besides just like playing an activity, but still being in that same kind of environment.
Yeah. And I think it's so important, not just for kids, for everybody, but kids especially, to be active. There's a mind-body connection, in terms of that endorphin rush for, when you're out for a run or whatever. And then it just helps the mental health side of things. And I love that at ProCare, everybody, but you specifically, sort of, foster that holistic view, right? Where it's not just about fixing the issue. Sometimes it's about fixing the people too.
Yeah.
And I count myself among the fortunate who can, have claimed that. And this was great. I really appreciate you coming by and sharing some of your experiences today.
Of course. Thank you for having me.
Yeah, this was great. And hopefully I see you soon, but not too soon, at least in terms of an outpatient, inpatient scenario there.
Exactly.
But thanks so much for coming, Christine. And thank you, everybody, for listening wherever and whenever you are.